Have you ever had a case of a rear end lameness and you weren't sure what was going on? I'm going to go through something that may not be as common, or you may not notice it when you do see it. This is the story of Rio. Rio came to me from Tennessee. He's a 10-year-old border collie who went from being really competitive and active doing agility and fly ball to having to slow it down to just doing herding of sheep and ducks. 5 months previously, before he came to see me, he had a TPLO on his right side and he wasn't really sitting very well with it. When he was standing, he was actually shifting weight off of the right onto the left. Well, the surprising thing was he had some significant stuff going on in his left side, whether it be with the CCL or separate from, can't tell you. What I can tell you is that his tarsal joint was like almost twice the size of the other side. It was huge. In this x-ray, you can see what it looks like when there's a fusion. So this whiting here, that fluid is fluid or a fusion in the tarsal joint. And a fusion is an outward sign of inflammation. Now in these pictures, this is a normal size malleolus. If you see here, this is huge. I blew it up for you. So here's your normal size. And then look at the size here. It's so much bigger. It's like 50% bigger. So what did we do for Rio? Well, we lasered him, of course. That actually dropped the size by about 30%. So still not normal, but a lot better. It decreased the synovitis, the inflammation in the synovial capsule, and the effusion, and decreased some of the inflammation around the joint. We recommend doing that regularly until he's comfortable and we have maximum range of motion. Also, at home, he can use PEMF, pulse electromagnetic field therapy, either in a loop or a bed. We also continue to do range of motion exercises until we can get him as normal as possible and then get him stronger with it. What else can we do? We can do some traction where you stabilize the tibia, keep the hock at a 90-degree angle, wrap your hands around those metatarsals and pull down the line of the tibia. What that does is it stretches the whole joint capsule and that decreases pain at that joint and allows it to flex and extend better. So we have better range of motion just by doing the traction. You want to hold it for about 3 to 5 seconds, then extend the joint, open it up all the way, and then flex it and see if everything is better. And it may not be, and if it's not back to normal, there's another thing we can do. It's called a Mulligan Technique. I learned this from a human course and applied it to dogs, and it works great for me. It actually opens up the medial joint capsule. Here, we're going to stabilize the tibia, and don't worry, I have a video to show you the whole thing. We're going to internally rotate the foot, so grabbing from the metatarsals. Then we're going to do flexion about 20 times, gentle flexion, not like, right? Just gentle so that you have some resistance. Then you extend it all the way, and then flex it and reassess it. So here we are, we're looking at the bones. So you can see the lateral aspect with the fibula. We're going to rotate it and then do flexion. Again, not compression, this is flexion. And here's what it looks like on the dog. Internally rotate, and then flex, extend it all the way, and then reassess. Once we have our range of motion back to normal, then we need to strengthen the muscles, tendons, and ligaments that support the joint. Having our Cavaletti poles, these are Cavaletti Jacks, right? I designed them, it's so exciting. Really close together forces the dog to pick their feet up, and we get full flexion of each of those joints, the hip, the stifle, the tarsus, so that we can strengthen those muscles and those structures. We can also sit on an incline. So once we have our dog being able to sit square, we start low. So this is an 8-degree incline. On the upside, we have increased compression. So we're increasing the flexion, making sure the dog can hold that. And then the weight is shifted to the downside. And all of those structures have to work to hold the body up. It's an amazing exercise. You think, oh, that's easy. Yeah, try it for a while. Just sitting there can help strengthen everything on that side. And because we want the flexion and we want the strength, we do it in both directions. So here's Ollie showing you at 8 degrees, 15 degrees, 25 degrees, and even up to 30 degrees. Now, if you're using it for an athlete, we can even go up to 40 degrees. And this is the ActiBoard. We also want to think about supplying the body the nutrients it needs to help fix and keep strong the structures that were injured. So Standard Process has a great product. Well, they have two great products. The human version is Ligaplex. The dog version is Canine Musculoskeletal Support. Either one of those are wonderful. And remember, if we tear a cruciate or we have an injury, it takes a long time for these structures to heal. So I recommend them being on this for at least a year, if not 2, before I even think about taking it off. Remember, if I have a ligament issue, it takes, well, it's healed about 80% a year later. So it takes a long time. So we want to be on there. Also, I recommend collagen, as that can help the joint surface itself. And Rio's already on some chondroprotectants, so that's wonderful. And update, Rio's continuing to improve. Okay, I'm Dr. Laurie McCauley from Optimum Pet Vitality. I hope you had fun. I hope you learned something, and I'll see you next time.